This is Cecilia Keady. I'm a family nurse practitioner, and I'm here to talk to you about shingles. Shingles, we know that the chickenpox virus never really leaves the body, and it can come back as a painful rash of shingles. If you have had chickenpox, you can get shingles at any time. It doesn't matter how healthy you feel. Shingles can strike when you least expect it, and it can cause blistering rash that may bring deep, penetrating pain. The shingles rash can last up to 30 days, and for most, the pain lessens as the rash heals. But some people, unfortunately, who develop shingles experience long-term nerve pain that can last for months and even years. Many times I get questions from our patients saying, how do I know that the rash that I have is actual shingles? You will know because it's a band, a strip of a small area that appears anywhere in the body, but it will always be on the same side of the body, either the left or the right. The blisters will form. There's fluid inside these blisters. The blisters are usually clear, but might become cloudy after 3 to 4 days. Few people won't get a rash, or the rash might be mild. The rash can come in the forehead, in the cheeks, on the nose, or around the eye. If you do get in the eye, please let us know right away, since this is called herpes zoster ophthalmicus, which may threaten your sight unless you get prompt attention. People that have shingles have pain that is described as piercing needles in the skin, and may occur along the skin with a rash. The blisters may break open and they ooze and they crust in about 5 days. The rash, as I said before, will heal in about 2 to 4 weeks. And although some scars will remain, you will, as I said before, be left with some pain. As you get older, there's a greater chance that shingles can happen to you. It's a simple fact that as we get older, our immune system weakens. And as a result, your chances of developing the shingles rash increases as you get older. We do have a vaccine called Zostavax that is for patients to prevent them from getting the shingles. However, it's not recommended on patients that are immunocompromised or take high doses of steroids, such as patients that have COPD, or patients that have HIV or HIV positive or have AIDS. The next question we get from our patients is, what do I do when I have a shingles rash outbreak? The number one thing to do is to avoid picking and scratching the blisters. Leave them alone. The blister will crust over and fall off naturally. Use cool, moist compresses, which will ease the discomfort. Lotions such as calamine might be applied after you do the wet compresses. I like the cornstarch or the baking soda, which helps to dry the sores so they heal more quickly. And the sores will crust over quickly. And as soon as they're crusted, as you know, you're not contagious anymore. You can also apply a cream, which is something you will need a prescription for. We definitely want you to take some ibuprofen or Tylenol for the pain. And the main thing to do is, again, not to pick the lesions because they could become infected, and therefore you can have a worse problem. We know that 1 in 5 people who get shingles will experience long-term nerve pain, and this is really unfortunate. Most people that recover from shingles do fine, but as I said before, 1 in 5 people will develop what is called post-herpetic neuralgia, or PHN. This is a nerve pain that can develop even after the rash is gone. And they can range from severe to very debilitating pain. The nerve pain can last for over months and months or several years. This is the reason why getting the shingles vaccine is a really good idea for patients that would like to get that. Most insurances pay for the shingles vaccine. You do have to call your insurance company and see if they will actually pay for it. It's indicated for anybody over 50. If you have had shingles, you can still get the shingles vaccine. Most common misconception I get, questions I have from patients is, well, I had the shingles already. I don't think I'm ever going to get it again. No, you will get it again. But as I said to you before, the shingles is a zoster vaccine that is live. So if you are under the care of a provider for cancer or COPD, you have to let people know that this is what you're taking, therefore you will not qualify for the shingles vaccine. There is a way to prevent shingles. The vaccine will help you about 50% of the time or more, but will not completely resolve the problem or protect you 100%, but it's a good way to prevent you from getting shingles. I hope this was helpful, and I will be coming back to talk to you about other topics that are had on our list. And it was a pleasure talking to you today, and you take care.